Good afternoon and welcome to this recording, Bridging the Knowledge Gaps, an update from the EHRA SIC Committee. It's my great pleasure to be here today with our guest, Dr. Marco Bergonti from Switzerland, Lugano, and Professor Maura Zilla from Germany, Heidelberg University, and Professor Chun from Frankfurt am Main, also in Germany. So thank you to be here. And we will give you today an overview of our work in our committee. The EHRA Scientific Initiative Committee is a committee whose goal is to give an overview of the daily EP practice across Europe and also to dive into the complex and application of the arrhythmia management across the European countries. But I don't want to talk any longer. I will hand the floor to Professor Chun, and he will give you the numbers of our committee.
Yeah, thank you very much, Laura, and hello, everybody. It's my greatest pleasure, first of all, to be, and I felt very privileged to be in the lead or in the chairing position of the EHRA SIC Scientific Initiative Committee, which is a great group of very motivated people who really want to drive the field of electrophysiology. And over the time, we developed a certain process how to select a certain project and to make it work and get it published in the end. And in the last year, we received the record high number of 25 project proposals. And out of those 25 project proposals, we selected 9. And those projects were then have been working on those together, and the goal is to create either a survey, a meta-analysis, or also some retrospective, let's say, registry survey-like analyses. And we did work from VT, risk stratification, diversity projects, but also pulse field ablation. And we feel, and I hope, that together we are advancing the field of electrophysiology.
Yes, Professor Chun is our chair, and he is the chair of this committee since 2022. And so he really had a great experience in our committee. And as he already said, we performed a lot of research in the form of patient survey or a center-based survey or physician-based survey, as well as systematic review and meta-analysis. And we are fully consistent, and we truly believe that this will help to implement the current guidelines by bridging the gaps in the EP fields. And one of the latest publications was the one from Dr. Marco Bergonti, which was very appreciated because it explored the real-world data on PFA application and PFA ablation in the field of PVI. So, Marco, could you please give us some insights of your work?
Sure, thank you very much. So yeah, this old project, I think it started back in April 2024, if I'm not mistaken. And then there was a very close selection of all the questions. And for that, I have to thank all the committee because everybody reviewed all the questions and there were very insightful hints from everybody. And in the end, we were able to put together these 30 questions, which were then distributed online. And then we got, I think it was about 215 answer. So that means that there were 215 participants in this survey, and we wanted to understand a bit how PFA was reshaping the world of ablation and specifically AF ablation in this setting. I think that what was astonishing at first was to see how things were changing between 2020 and 2025. Because that was one of the questions. In 2020, I think first PVI was split 50% in cryo and 50% RF. And just 5 years later, PFA now constitutes about 50% of all first PVI. And I think that both operators, both performing cryo at first or RF at first, are both switching towards PFA, and that gives you the magnitude of the change. And also this is coming also to the redo procedure, where this PFA adoption is becoming more and more frequent. And well, for first PFA, we saw that operators are preferring single-shot devices. In a redo procedure, I think it was mostly like a large tip catheter or small tip catheter for individualized lesions. Also, what was noticed is that the trend was involving all Europe, but with some heterogeneity, especially concerning the type of centers that were included. So as you can imagine, high volume center were the fast adopters of PFA, while low volume center was the slowest one, and also based on the economic or the economic origin of the different countries. So let's say richest country were the fastest adopters. That's mostly linked to the fact that this platform is more costly than the previous one, while the other countries were following.
Yes, thank you, because this is very important as we notice how the PFA was currently really used by each country, and we also identified some barriers to its implementation across different European countries. But let's move on, and let's involve now Professor Marazzilla. She was very active in our committee, and she did a very, very good job in this year. She was the lead of many projects, and but I would like to ask her what are the new projects and the ongoing project right now, and what are your feelings about the future of our committee?
Yeah, thank you very much. It was, of course, a pleasure and a privilege to be part of this altogether very active committee. So thank you to everyone who was involved in that. Even though we've done a lot of interesting projects and finished them already and published them, there are still, of course, many gaps in knowledge that still persist with new technologies, but also with different population subgroups that have not been sufficiently analyzed maybe up till now. So one project that's currently ongoing is in relation to PFA. IPD meta-analysis, so really analyzing individual patient data regarding sex-specific differences in PFA in atrial fibrillation ablation. We know that when it comes to atrial fibrillation ablation, there have been sex-specific differences described. Women are referred later for AF ablation. They have shown less efficient results when it comes to rhythm control with PVI, and have also shown more complications. And there have been signals from large registries like the Manifest registry that with PFA these sex-specific differences might have been somehow mitigated. But of course that's registry data, and we really have to look deeper into that. So we are currently conducting this IPD meta-analysis and gathering data from all the evidence that is out there to analyze this very important aspect. There's another project related to this topic that's also co-led by Mark Mills from the UK. We did a survey regarding diversity and equity in arrhythmia care, and trying to expand the view regarding arrhythmia care for every kind of arrhythmia and every kind of setting, from diagnosis to treatment to follow-up, and to try to see if there are perceived inequities when it comes to different population subgroups, not only women and men, but also differences maybe when it comes to different income groups, when it comes to race, maybe also age, and we try to see if the physicians in Europe perceive some barriers and also challenges in treating really every population subgroup that comes to us with arrhythmias really equally. And we are very interested in the results and currently analyzing them. So that's very an important project.
Yes, thank you. And we are also very looking forward to seeing this result that will be presented during the next EHRA Summit, because the topic of the next EHRA Summit will be diversity. So we will very happy to share your data. Thank you, Mara. But now, the last but not least project of our committee was a very big project that was born during the previous term under the lead of Professor Chun and the co-chair Sergio Castrejon. And it was about a very, very big registry investigating the periprocedural stroke during AFib ablation. And so the data are now out and are published in the European Heart Journal, but I would like to ask you, Professor Chun, to give us some insights of this very interesting study.
Yeah, thank you, Laura, again. And I have to say, I feel very privileged to work with this group of people. And as you put it, and as you said, in the previous term, I was working together with Sergio Castrejon as the co-chair of the EHRA SIC. And we developed the idea that we wanted to better understand the true rate of thromboembolism or strokes in the context of catheter ablation of atrial fibrillation. And we created a worldwide, a global network based on the SIC, basically, drive. And we were able to collect, and I think this is the world's largest series, more than 330,000 procedures in 204 centers across 56 different countries, basically covering data from every continent in the world. And we calculated a statistical risk of 0.16%, so which is reassuring. It is a very low risk of embolism in the context of AFib ablation. And then we also looked, of course, into different time courses of strokes or embolic events. We also looked into different energy sources, which may have played a certain role. And we also looked into, let's say, volumes of different centers. But I don't want to spoil it too much. This is something you should look up into the European Heart Journal. And Sergio Castrejon and the team Madrid with Jose Mourinho, they did a tremendous work really to manage these big data. And yeah, as you said, it was a project which was born in the SIC, and therefore this would be my call to the audience is if you have an interesting project, if you want to go and drive an idea, what is the current practice in the EP, get in touch with us, get involved, and put in your proposals, and then we will decide on it and hopefully cooperate in future.
Yeah, totally agree, Professor Chun. And so I also encourage and invite you to send your proposal to our committee, so to advance the knowledge in the EP field, and we will wait for your proposal. Thank you very much for your attention, and stay tuned for our next steps. Thank you.
Thank you, Laura.
Thank you.
Thank you.